I will go look at some of the questions we have because we do have several several questions from the Q&A. So initially, the first question, I think part of it was approached in your speech, Chris, but does your predicted decline in population smoking levels account for the disruptive influence of black market activity? So does that specific study prove the evidence around black market activity?
Yeah, it's a great question. One of the things we're blessed with living in New Zealand is that we're a long way away from any other country, and it's quite hard to get illicit products across our borders. So unlike countries that are geographically joined up and surrounded by other countries where it's relatively straightforward to smuggle across borders, it's a lot trickier here and more expensive for smugglers to do that. And so we've got that advantage of the tyranny of distance being our friend for a change in New Zealand. So recognizing that we've probably got it easier in this regard than many, many other jurisdictions around the world. We've also had some recent great investment in border enforcement and monitoring of illicit products. So there's a special tobacco task force group within our customs department that have a heightened awareness of some illicit tobacco coming across in containers, for example, hidden in whiteware products or other products, and also in through the mail, the postal service. And so there's a lot more activity going on, and a number of very large seizures have been intercepted at the border, and they always get a lot of media attention, which gives the impression that this is sort of happening regularly and that the volumes of tobacco coming into the country are huge. And some of these interceptions certainly are very large. But if you look at we've done a number of other sorts of studies that use different methods. And if you look at the triangulating those results from those studies, so discarded pack surveys where we go around different cities and towns, particularly port cities, and look at the tobacco packets that are waste tobacco packaging and see if they comply with New Zealand packaging legislation. And if they don't, they've either been bought in under the duty-free allowance that you can bring in, no more than 50 cigarettes, not 50 cigarette packs, but 50 cigarettes legally in New Zealand, duty-free. So not many people bring much over that because it's so expensive, or they've been smuggled, and the most likely thing is they've been smuggled. Well, those discarded pack surveys have been done by various groups in New Zealand over the years, and they're all, broadly speaking, trending down, and certainly lower estimates than some of the similar surveys that have been sponsored by the tobacco companies, actually. So we never trust the tobacco company sponsored versions, but our own research is suggesting the trend is downward. The graph I showed you was based on what are called the tobacco returns. Every tobacco company marketing products in New Zealand has to declare the volume of products that it brings into the country. And then we look at the New Zealand Health Survey, which is run every year, which gives us an estimate of how much people are smoking, both the number of cigarettes and the population prevalence of smoking. And so you can look at the gap between the amount of cigarettes for sale and the amount of cigarettes that are being smoked, and that's called the consumption gap. And that gap has been declining. And so that's a kind of an indication of the amount of illicit tobacco in circulation. Some of that might be homegrown. You can grow tobacco quite well in New Zealand. If you grow it for personal use, that's legal. If you try to sell it, that's illegal because you're doing the government out of excise tax. So we believe that, in answer to your question, the predicted decline in population smoking does account because the disruptive influence of back market activity is relatively small and diminishing over time, despite what people say. Sorry, long answer to a good question.
No, that was a fantastic answer, and I think that's a very strong point that as the number of smokers decreases, the demand for the black market decreases. So potentially even in countries where it's difficult to control border passages and flow of tobacco products, probably decreasing the amount of addiction will also
Yeah,
decrease black market demands. Yeah.
exactly, exactly. So that is what we anticipated as you reduce the number of people who smoke and the addictiveness of the products, the appetite goes, if you like, and not so much of an issue. There's a question
So
there.
I'm gonna pick out. Oh, do you have one you have an eye on, Chris, or I'll pick out one?
Oh yeah, there's the one about how can the policy of purchasing cigarettes at retail be effective, uh, which I think that's the retail reduction policies you're referring to, perhaps. So the idea is that if you just reduce accessibility, um, then often what happens is people just think it's just not worth the effort. That's quite frankly what happens if you make it harder to get and out of sight, literally out of mind. Um, Experiments with people who work on oil rigs who can't smoke for 2 weeks at a time when they're working on the oil rig, where cigarette smoking is out of sight and out of mind. People are able to manage not smoking for that period, but as soon as they get back to land and they see all the marketing and promotion or other people smoking, it evokes, these cues to smoking that provoke the desire to smoke again and elicit the craving for cigarettes. So if you take them out of sight, we're doing a favor for people. And there has been good research, and not just with cigarettes, but a range of other products, that if you decrease their visibility and make them harder to access by distance or effort, then people just think it's too much of a hassle and will give up. In many jurisdictions in New Zealand, particularly tribal areas, the leaders of those areas are saying, we don't want tobacco in our area. This is a product that's done harm for over 150 years to our people. It's killing people, continues to reap a harvest of death and disability. We don't want it in our area anymore. And some small convenience store owners have voluntarily quit selling cigarettes. So I think this is sort of just a people power that we need to see growing. And if the grassroots movement can actually supervene and show the government up, then I think we're on a bit of a roll. So I think actually falling back on that community-led initiative, Maori leadership, is actually a real strength, which we've still got left in our tobacco action plan, and we need to maximise the opportunities there for us.
I see that Dr. Prajwal has his hand up, but I'll quickly address this participant question. So this is unfortunately a struggle in Australia too, with Aboriginal and Torres Strait Islander people suffering similar inequities. Is there any studies in New Zealand that have evaluated the effectiveness of anti-campaigns? How would one approach a campaign to target visitors and staff to avoid smoking around medical facilities and campuses?
Short answer to a good series of questions. Yeah, for Indigenous people all around the world, they've been targeted by the tobacco industry, and the legacy of harm for Indigenous Australians is not too dissimilar to the legacy here in New Zealand and in many other countries around the world. Just acknowledging that tobacco is used as a ceremonial product in some areas of North and Central America, where it's used in a way that's highly unlikely to be particularly harmful. So we're talking here about commercial tobacco use, which is incredibly harmful, exploitative, etc., etc. There are studies that have evaluated the effectiveness of anti-smoking campaigns. Generally, there are small effects from different types of campaigns, but we've just recently evaluated a project led by our Auckland City Council, which involved really innovative work with Māori and Pacific communities who came up with the ideas of their own about how to do group-based quitting smoking, and the quitting rates in those groups have been phenomenally high because they involved social networks and social support, helping each other through that process. That doesn't address prevention, but it does deal with the 250,000 people who are still smoking, who most of whom want to quit smoking and just need some support. So I think, but also prevention of starting smoking is the other thing that we can't afford to drop the ball on and think we've done the business. Even though in New Zealand, young people smoking is incredibly common, they've also started to use vapes at high levels, and now heated tobacco products are being priced more favorably for them, and they contain tobacco. And then there's oral tobacco and nicotine products, which are on the horizon as well and taking off in many other countries. So we can't afford to be complacent about the wily approaches of the tobacco industry. And yeah, so there is research that's been done. I know there's been fabulous research done by great research teams and groups working in with Aboriginal researchers and communities and in Australia that have shown some benefits from prevention and cessation support interventions in those communities.
Kia ora, Chris. Thank you for that, drawing those connections between Indigenous communities across the world. Um, Dr. Prajwal, I see you raise your hand, so I'll pass the ball to you here.
Okay. Thank you, Professor Chris, for your wonderful presentation. My question to you is, what was the mindset, when New Zealand started banning of tobacco, products for age, for I think for those age 18 years, less than 18 years, and in 2000 those who are born after January 1st, 2009, and why, that was again, what are the factors, that prevented for the execution of that law? You know, I want to
Sorry,
know about that.
right. Sorry, Dr. Prajwal. I didn't quite hear which specific issue you were. Your connection wasn't very good. So maybe Ronan, you can just, which particular issue was it?
I
On New
think
Zealand?
Dr. Prajwal is potentially asking what were the factors that drove the government to select the age that we would be
Oh,
preventing
okay.
tobacco under,
Right,
and what enabled it to happen, like the energy
right.
and the political will.
Yeah. So I think, we had, I think you've got to line up all your ducks in a row, if you like. And I think we had years and years of evidence-informed advocacy and respect for research evidence. So it was based on evidence from some other jurisdictions around what has been effective. Certainly Singapore looked at this a number of years ago. There's been some success in a municipality in the Philippines, some jurisdictions in the United States, and there are a few other places where similar approaches had been used. And I think the work here in New Zealand by other colleagues suggested that it would be better to go with the sort of turn the tap off in the prevalence pool by setting an age, a date, or if you like, or establishing a cohort of non-smokers or people who couldn't be sold tobacco, rather than having a hard sort of age level cutoff, because of the risks of sending the message that one moment smoking's bad for you, the next moment it's okay to smoke when you're an adult. And that smoke-free generation idea gets away from that. So I think that was supported by enlightened politicians who thought that that was smart and bought into the evidence base around that and the public support for that policy. So I think, it's a combination of years and years of hard work, of building up credible research, of lobbying and just chipping away, and then finding the right political moment to get a politician of the day who wants to bear the torch to do the right thing, to stand up and push this through. It's a hard-won battle, and politicians, I've sort of I've been a bit negative about them, but if you get the right person in the right role at the right time, then they can make a huge difference. And there are many examples in the tobacco control world of that, and we've got a great legacy of such people, from Dame Tariana Turia and Hone Harawera and others back in the 2010s with the Māori Affairs Select Committee, and getting our current, comprehensive tobacco control in place all those years ago. And so we're deeply indebted to those people who acted boldly and saw the opportunity when they were had moments of political power. So we do need to work with, but when we've got, politicians who are not listening to the evidence and listening to the tobacco industry, privileging their evidence, so-called, then we're in trouble, and that's the situation we're in at the moment. And all advice from friends around and colleagues around the world is welcome, because it's a new space for us to be in.
Thank you,
Sure,
Professor Chris.
Chris.
Thank you. Yeah.
In the interest of time, I think we will answer just one or two more questions. So, from an Australian participant, Australia has made the move to only provide vapes through pharmacies, but did a complete U-turn, and instead of making them available as prescription-only items, they're pharmacist-only items, increasing the burden of pharmacist-patient interactions to supply vape products. Has New Zealand or any other country moving in a similar direction to Australia's approach to vaping products?
Short answer is no. Australia seems to be forging its own path in this direction now. New Zealand's approach to vaping is more like the UK's, which is more permissive than Australia's. And so New Zealand has so far taken an approach that vaping is a two-edged sword. Initially, when the evidence around vaping as a smoking cessation tool started to build, the government thought they could regulate it sufficiently and allow it to be sold as a consumer product that might help some smokers to quit. And certainly there's some evidence to suggest that it might have helped a lot of people who smoke to switch to vaping, and therefore to quit smoking, reduce their harm. Now, I realize that's sort of perhaps anathema to some people listening, but that's what's been the approach that's been taken in New Zealand. Now, unfortunately, with the evolution of vaping products and the power of social media, in about 2019 and around the time of COVID, etc., we were in a bit of a regulatory vacuum here. We had very little control over the vaping market, and then nothing much happened for a couple of years, during which time the vaping industry and some of its proxies really took hold, and vaping amongst young people took off, most of whom have never smoked. And so that's a bad thing. So we've got this issue of trying to make vaping in a regulated way, without having too much of an illicit trade in vapes, such as the Australian situation, for a tool for smokers to quit smoking, but not enough of availability and not too price attractive, or sending the message that they're a good thing for people who've never smoked to use, particularly young people at a vulnerable time in their development and life. And so I'm pleased to say that by the end of this year, we will have banned disposable vapes in New Zealand, that their advertising or the visibility of vaping marketing in stores and in stores and in the store windows will be gone. And the nicotine levels are being audited and monitored. And so the whole industry is being sort of put under much tighter scrutiny and controls, which will go some way. But the bad news is that these guys are really skilled at marketing their products to young people, and they see in them a huge commercial opportunity. So again, we shouldn't underestimate the bad behavior and wiles of these companies. They advertise illegally online. They use influencers on all the social media platforms that you can think of, and it's almost impossible to keep pace with their marketing. Very, very difficult situation we're in, and it's going to get worse with oral nicotine pouches, I believe, in our part of the world very soon, being aggressively marketed and becoming a real lead product for the tobacco companies. So watch the space.
Chris. Yeah, a lot to see in the vaping products arena. There's a participant who has raised their hand, so I'll ask them to unmute. If they're able to unmute and ask their question, otherwise I can read off. Oh yeah, there we go.
Hello.
Hello.
Yes, this is Dr. Twatwa from Uganda.
Hello. How are you?
I'm all right, thank you. How are you?
Good, good.
I can see that the stumbling block in the struggle towards the reduction of smoking is definitely the politician. what contribution is the tobacco industry making in the government revenue? Then number two is, of course, those of us who are struggling to ensure that we reduce smoking. What alternatives have we given the politician to raise the money? I think their interest is the money. So we need to think of the various alternatives to give them so that they can actually now join us and reduce, ensure that smoking is reduced.
Great
the last
question.
smaller question, the last smaller question is that I did observe, maybe correctly, that it appears the women smoke more than men.
Right.
What is the cause?
Mm-hmm.
Those are my few observations. Thank you.
Very good. Great questions and comments. Thank you very much. I'll just answer the last one first. So you're absolutely right. For Maori women, smoking prevalence has been traditionally higher than for Maori men, which is unusual. In most parts of the world, it's the opposite. And in fact, in most Asian countries, fewer than 5% of women smoke, whereas about 50% of men smoke in countries like China and other parts of Asia. But in New Zealand, I think tobacco was introduced as a trading commodity. It became popular in pipe smoking by Māori women. And I think perhaps just the whole influence of colonization and stress and strain, it may have been something that people did and was encouraged to use as a way of kind of coping. It's quite complex, but it certainly is a challenge. But I think if you looked at the graphs around our modeling for denicotinization combined with the other strategies, would see actually smoking among Maori women declining really dramatically alongside Maori men. So the differences would probably disappear quite rapidly, which would be the first time in many, many years. So that's just a quick sort of superficial answer to that one, but it is a complex situation, but I think it's got its roots in colonization and a long arm of the history of the introduction of tobacco in New Zealand and how it's sort of embedded in cultural practice, well, not cultural practices, but adopted practices and behaviors in those communities. Going back to your earlier questions about the role of the importance of revenue to governments from tobacco, and now many countries around the world depend on tobacco as a commodity. In fact, the tobacco industry has sort of made some countries totally dependent on tobacco for their economy, and that, of course, is an extremely dangerous place to be in, and it's harmful in its own right for people working in the tobacco fields who can get sick from all the nicotine they absorb when they're doing their work. But you're right, that's a tremendous temptation for politicians to argue that we need the revenue from the excise tax on tobacco to be able to pay for schools, education, hospitals, healthcare. But really, they need to look on the long term at the long run costs of having large proportions of the population smoking. And we know that the inevitability is that large numbers of those people, perhaps up to half of those people, will start to have the impact of health effects over the age of 40 when they become irreversible, and they will have lives that are 10 or 15 years shorter. And some of those people who started smoking quite young will actually die in some of the most productive years of their life. So the impact on the economy actually is down the track long term, but the equation is not favorable for continuing to have tobacco as a product that, yes, it brings in the short term easy money for governments, but in the long term, it costs a lot more in terms of human suffering, healthcare costs, and loss of productivity. So I think, politicians need to be thinking about not just what the next few years are, but the next few decades, really. And unfortunately, they haven't been showing themselves to be very good at that with climate change. And unfortunately, equally, they're not up to the task generally with tobacco. So in terms of alternative sources of revenue, well, we removed tobacco as a commercial crop in New Zealand a number of years ago. became illegal to grow tobacco for commercial purposes in New Zealand. So those farmers had to come up with replacement crops. Some of them moved into growing hops for making beer or grapes for making wine, which is kind of ironic because they've gone from one harm industry to the next, but they're also growing other crops, which food, which other healthy foods. And so that transition was supported and cost the government a bit of money to do that, but it's been done, and it serves as, I think, a good model for other countries. Growing, tobacco in large areas as a monoculture is really bad for the soil, and often a lot of pesticides and fertilizers are used as well. And in the long term, that's not great for, the soil of a country. So there are a whole lot of reasons beyond my area of expertise in agricultural reasons and economic reasons why permitting the growth of tobacco, and then also depending on tobacco revenue to fund government expenditure on other things, it's a really bad idea. And our government is just as guilty of doing that with its recent moves to fund tax cuts for middle and class and wealthy New Zealanders. That is really wrong in my book. It just smacks of being incredibly unethical. But we're working on trying to bring about change. And thank you for raising that question. That was a really good one.
Our final question is, when creating the smoke-free generation policy, the policy stated that they wanted to ban further sales of tobacco to everyone below 18 years. What were the measures planned to help those individuals from that age group who had already started smoking?
Okay, so it's actually around banning the sales to anyone born after January 1st, 2009 and forever onward. But yeah, you're right. There are a group of young people who have started smoking much younger than whatever, 18 or 19 or whatever. So what are we going to do to help those people? And the reality is the evidence for quit smoking support for young people and teenagers is actually not very good. There isn't a whole lot of evidence about what works. It's likely that all the things we use for people in the older ages are probably equally effective, or maybe worth trying anyway. But I think there is some evidence around text messaging support and delivering behavioral support in novel ways that reach young people in their kind of daily lives with support. Group-based programs, nicotine replacement therapy probably could help some young people, but it doesn't seem to have been particularly effective in trials with young people quit smoking. So I think going down prevention of the presence of tobacco as a normal product in our daily lives in the country is really important to sort of change the setting and the scene and the normality of it. And that's incredibly helpful. Putting the price up is probably the single most important thing, and prohibiting the sale of single cigarettes. So if people go to buy tobacco, they have to spend an awful lot of money to get, one packet of tobacco. They can't buy a single cigarette. You can't stop social supply, i.e. supply from brothers, sisters, or friends or parents, but you can try and crack down on making it easy to buy these products, and their visibility and their normality in our daily lives. And that requires a comprehensive tobacco control program that operates at all these different levels to denormalize and get rid of smoking from society, and then young people won't be tempted. And people who are already smoking, like you're mentioning in your question, will find it much easier to quit in that context, because all the cues to continue smoking and the kind of any positive feedback they get from their friends about smoking will actually go. And so it will be very unrewarding in many ways.
Yes, Chris, that was a very insightful answer for looking at the health of our young people. I'd like now to invite Dr. Prajwal to just wrap us up with a brief goodbye to everyone. And then everyone, I hope no matter what time of day it is, you have a great rest of your day. And I thank you, Long, for coming along.
Thank you, Professor Chris, for your wonderful presentations. It was very much insightful. And, the tobacco is not a single country problem. It is a global problem, I believe. So we can work together as a the World Federation of Public Health Association has given us a very good platform, to expand our global networking and work for anti-tobacco campaign around the world. So let's work together to create a tobacco-free world. Thank you very much.